What should you do prior to lung biopsy procedure if you are taking a blood thinner medication such as warfarin, Eliquis, Geroto, or Badaxa? If you are taking warfarin, you should recheck your INR about 2 weeks prior to the procedure. If your INR is therapeutic and you are stable with your warfarin, like you have a stable INR history, then you should hold your warfarin for 4 to 5 days prior to the procedure. If you have a critical INR like over 5, then you may need to hold your warfarin and then reduce your warfarin dose and recheck your INR in about 1 week prior to a procedure. If you have to hold your warfarin for more than 3 days, you should reach with a luminal injection to prevent from recurrent blood clot or stroke. You should follow your doctor or the anticoagulant for breaching instruction. If you have to take the Eliquis, Geroto, or Badaxa, you may need to check your kidney function. If your kidney function is normal or creatinine clearance greater than 50, then you may only need to hold your Eliquis, Geroto, or Badaxa for 2 days. If your kidney function is not normal when your creatinine clearance less than 50, then you may need to hold your Eliquis, Geroto, or Badaxa for more than 2 days. When you hold for more than 2 days, then you may need to delay to resume your Eliquis, Geroto, or Badaxa. You should follow your surgeon or proceduralist to resume your blood thinner medication. Any question, you should check with your doctor who managed your blood thinner medication or your anticoagulant clinic. If you have any question for me, please let me know in the comment box below. Thank you. Prior to lung removal procedure, what should you do if you are taking blood thinner medication such as warfarin, Eliquis, Geroto, or Badaxa? If you are taking warfarin, you should recheck your INR in about 2 weeks prior to the procedure. If your INR is therapeutic and your INR history is stable, then you may need to hold your warfarin for 4 to 5 days prior to the procedure. If your INR is critical or elevated, your doctor who manages your warfarin or your anticoagulant might need to hold your warfarin or reduce your warfarin dose and recheck your INR in about 1 week to make sure your INR is good before they can plan for your procedure. If you have to hold your warfarin for more than 3 days, the rich global injections from having recurrent or stroke. If you are taking Eroto or Badaxa, you may need to check if less than 50, then you hold your Alato Badaxa 2 days prior to the procedure. Creatinine clearance greater than, then you only do Alaquis, Eroto, or Badaxa prior to the procedure. You may need to delay if you for more than 3 days. You need to follow your doctor or the anticoagulant. You should resume your blood thinner medication as instructed by or procedure list. Further question, please let me know in the comment box below. Thank you. Spleen surgery or the vascular surgery related to spleen. Prior to spleen surgery, what to do prior to spleen surgery if you are taking warfarin or Eliquis or Xarelto or Badaxa. If you are taking warfarin, you should recheck your INR in about 2 weeks prior to the procedure. If your INR is at therapeutic, you should go ahead and hold your warfarin for 4-5 days prior to the procedure. If your INR is a little bit elevated, you should adjust the dose a little bit and hold your warfarin for 4 to 5 days prior to the procedure. If your INR is very elevated or critical, then you need to hold your warfarin and reduce the dose and come back in about 1 week to make sure your INR improve, get back to the therapeutic level. Then before you can plan for the procedure. Anytime you need to hold your warfarin for more than 3 days, then you need to switch with the Lovenox injection. If you have a history of recurrent blood clot or stroke and strong risk factor of having blood clot or stroke, such as factor V deficiency. If you are taking the Lovenox injection to bridge when you off warfarin, you need to follow your doctor who manages your warfarin or the anticoagulant instruction closely. Make sure you understand when you need to start the Lovenox injection, when you need to stop the Lovenox injection before surgery, when you need to resume after the surgery, and when you need to completely stop the Lovenox injection therapy. If you are taking Eliquis, Xarelto, or Badaxa, you should check your kidney labs, make sure they are up to date. If they are more than 3 months old, then you need to update the labs. For those people who have kidney problems, such as kidney failures or chronic kidney disease, they should get the update lab. They should get the update lab sooner than 3 months. If they have a normal kidney function, if your kidney function is normal, you should hold for 2 days and resume the day after the procedure. If your kidney function is not normal, your creatinine clearance less than 50, you might need to hold more than 2 days, and you might need to delay resuming your Eliquis, Xarelto, or Badaxa. You also need to check with the surgeon or proceduralist to make sure if you are safe to resume your platinum medication. When is safe? When you are safe to resume your platinum medication. If any different, you should update to your doctor who manage your warfarin, your anticoagulant. If you have any further question, please let me know in the comment box below. Thank you. liver surgery or vascular surgery related to liver. What to do to liver surgery if you are in the medication such as warfarin, Eliquis. If you are taking warfarin, that you should recheck your INR about 2 weeks prior to the procedure. If the INR result is therapeutic, then your warfarin for the procedure. If the INR result is slightly elevated, then adjust your warfarin dose a little bit and hold 4 to 5 days. If you have elevated INR, critical INR, then you may need to hold your warfarin and reduce the dose and come back in 1 week to check your INR to make sure your INR improve to therapeutic range before you can plan procedure. So you should follow your warfarin and anticoagulant closely. You have a plan for surgery. Anytime you warfarin more than 3 days, I would recommend that you should reaching with the Lovenox. Check you have a history of recurrent blood clot, stroke, and strong of having blood clot or stroke, just factor 5 deficiency or some kind of genetic. If you have to reach with the Lovenox injection, you need to follow your doctor and anticoagulant closely to make sure you understand when to start Lovenox injection, when stop Lovenox injection for the surgery, and when to resume your Lovenox injection after the procedure. When stop the Lovenox injection therapy. The Eliquis erosion, but you should check, make sure within 3 months. If you have kidney problem, kidney failures, kidney disease, then you need more of the labs than the normal people. If your kidney labs within normal limits, then you should hold for 2 days. If the creatinine clearance not within normal limit, was then than 50, then you may go more than 2 days. You should resume your Eliquis, Xarelto, or Badac the day after the procedure if your kidney function is normal. Resuming your Eliquis, Xarelto, if your kidney function is not normal, you may resume after the procedure. So check with your surgeon or proceduralist. Make sure you are safe to resume patient. If any difference, you need to talk to your doctor who manages your blood or your anticoagulant. Any question? Please let me know in the comment box. Thank you. Liver biopsy. What to do prior to liver biopsy procedure if you are taking medication such as warfarin, Eliquis, Xarelto, or Badaxa. If you are taking warfarin, you should recheck your INR about 2 weeks prior to the procedure. If your INR is therapeutic, then you may need your warfarin for 4 to 5 days prior to the procedure. Is elevated, then you may need to adjust your dose to make sure you are improve even your INR history is stable. You need to hold your warfarin for 4 to 5 days prior to the procedure. If your INR is very elevated or critical, then you need to fish and be to hold your warfarin and reduce the dose and come back in 1 week to recheck your INR, improve, or before you can plan for the procedure. You should follow a doctor who manages your warfarin or the anticoagulant closely to have a good procedure. Anytime your warfarin more than 3 days, then you might need to contact with the lobenal injection. If you have a history of recurrent blood and strong risk factor of having blood clot or stroke, if you have to take the lobenal injection, you need to follow your doctor who manages your warfarin instructions closely. Make sure you understand when you need to start the Lovenov injection. When you need to when the Lovenov injection right before the procedure. Resume the Lovenov injection after the procedure. Completely stop the Lovenov injection therapy. If you are taking Eliquis or Badaxa, you should check your kidney labs to make sure your kidney is normal. If your kidney labs are more than 3 months old, then you should need update lab. If you have kidney problems such as or chronic kidney disease, you might need kidney sooner than 3 months. If your kidney function, excuse me, if your kidney function is normal, then you need to hold for 2 days prior to the procedure. If creatinine clearance less than 50, you need to hold your Eliquis or Badaxa more than 3 days, and you may need to resume about 2 to 3 days after the procedure. If your kidney function is resumed, your Eliquis Yeroto in procedure the day after the procedure. If your kidney function is not normal, creatinine clearance less than 50, then you might need to delay resuming your Eliquis. You should also check with proceduralist to resume your platinum medication. If any different, you should let your doctor who manages your warfarin or platinum medication, the anticoagulant, update the recommendation. If you have any question for the procedure, warfarin or other platinum medication, please let me know in the box below. Thank you. Transurethral resection of the prostate, TURP procedure. What should you do prior to transurethral resection of the prostate procedure if you are taking a platinum medication, warfarin, Eliquis, Yeroto, or Badaxa? If you are taking warfarin, I would recommend you should recheck your iron about 2 weeks prior to the procedure. If you have a therapeutic INR, then you should hold for 4 to 5 days prior to the procedure. If your INR is elevated, you may need to fix your INR, come back in 1 week to see if improved, and plan for the procedure. If your INR critical, you need to hold warfarin, reduce the dose, and come back in 1 week, check your INR, plan for the procedure. Anytime you hold your warfarin more than 2 days, you consider reaching with the lobanal injection if you have a history of recurrent blood clot or stroke and strong risk factors of having blood clot or stroke. If you have to reach with the lobanal injection, you should follow your doctor who manages your warfarin or the anticoagulant instruction closely to understand when you need to start the lobanal injection, when you need to stop before the procedure, when you need to resume it at the procedure, when you stop the lobanal injection quickly. If you are taking the Eliquis, Xarelto, or Badaxa, you should check your kidney function, your renal labs. Make sure you are up to date. If your labs were done more than 3 months ago, then you might need to repeat. If you have kidney disease, kidney failure, you may need to repeat the lab sooner. If your kidney function is normal, you need to hold for 2 days. If your creatinine clearance less than 50, to hold more than 3 days, and you delay resuming. You should check with the surgeon or proceduralist to see if you are safe from resuming the platinum patient. If any different, you should check on doctor who manage your platinum medication for the anticoagulant. Make sure they have the updates. If you have any question or concern about this procedure, what to do prior to this procedure, and or if you are taking platinum medication, please let me know in the comment box below. Thank you. Bladder tumor procedure. What should do prior to bladder tumor procedure? If you are taking warfarin, Eliquis, Xarelto, or Badaxa, I would recommend you should recheck your INR about 2 weeks prior to the procedure if you are taking warfarin. If you have a therapeutic INR result, then you may need to hold the warfarin 4 to 5 days prior to the procedure. If your INR result is elevated, just slightly high, then and you have a stable INR history, then I need to adjust your INR a little bit to make sure it get back to the therapeutic range. Then you hope for 4 to 5 days prior to the. If your INR result is critical, probably you need to fix that INR by holding your warfarin and reduce the dose to make sure the INR back to the therapeutic range or plan for the procedure. Anytime hold your warfarin more than 3 days, you need to consider reaching the lobenal injection if you have a recurrent blood clot or stroke history and you have strong risk factor of having blood clot or stroke, then you need to treat with lobenal injection of warfarin for more than 3 days. Your doctor who manages your warfarin or the anticoagulant will give you a separate instruction for the lobenal bridging. You should follow the instruction closely to understand when you need to start the lobenal injections, when you need to stop them before the procedure, when you need to resume them, when you need to stop the lobenal injection quickly. If you are taking the Eliquis, Xarelto, or Badaxa, you should check your kidney labs. Make sure it's up to date. If they are more than 3 months old, then you may need the labs. If you have kidney failures or kidney disease, then you may need to consider updating your lab sooner than 3 months. If your kidney function is within normal limit, then you may need to hold for only 2 days prior to the procedure. If your kidney functions is not normal, as your creatinine clearance less than 50, you might need to hold more than 2 days. And you might need to delay resuming your Eliquis, Xarelto, or Badaxa. You should check if you are safe to resume your platinum medication after the procedure. If anything different, you need to discuss with your doctor who manages for platinum medication or anticoagulant. If you have any question, concern, please let me know in the comment box below. Prostate biopsy procedure. What to do prior to prostate biopsy procedure if you are taking a blood thinner medication like warfarin, Eliquis, Xarelto, Adaxa. If you are taking warfarin, I would recommend that you should recheck your INR about 2 weeks prior to the procedure. If your INR history is stable and your INR result is therapeutic, then you will need to hold for 4 to 5 days prior to the procedure. If your INR history is not stable, your INR result is elevated, then you may